Shane Bishop of Catalyst Healthcare is a pharmacist by trade who one day realized there was an incredible business opportunity in connecting a new breed of pharmacy packaging automation direct to patients. Welcome, Shane.
Thank you so much for having me.
This is quite a journey, and of course we know each other from doing some business together. Mm-hmm. How does a pharmacist end up transforming the whole delivery of drugs to the patient?
Well, I guess, my story is I had the opportunity to set up the first closed-door, non-retail pharmacy in Western Canada, and to bring in a special type of automation that actually packages medications in a specific format, kind of geared towards, at that time, long-term care facilities. So a more efficient way for pharmacies to package medications, and also safer and more efficient for nurses to provide this medications from these pouches. It was after utilizing this automation and delivering this packaging format to nurses that I came up with this idea. And it was all based around the fact that I was seeing some inefficiencies in the pharmacy, miscommunications between nursing and pharmacy, and nursing still providing, at times, the wrong medication to the wrong patient or the wrong medication at the wrong time. Not the nurse's fault, just the system's fault. So I went out and I came up with this concept whereby I approached the vendor of the actual hardware that provided it to my pharmacy, and I said, listen, I would love to be able to have a software platform that basically takes all the information from pharmacy, sends it to your automation. I'm going to tell you what to package. You tell me it has been packaged. And then I'm going to provide that packaging up to a nursing station where a nurse is actually going to scan the barcode on that pouch, and up's going to pop Randy's picture and actually ensure that it is in fact the right medication given to the right patient at the right time.
This is a huge, huge problem in the medical community, and especially with our aging population. So much of the medication that ends up getting prescribed doesn't actually end up with the patient, or they get the wrong medication. Talk to me a little bit about the need for your product.
Yeah, I mean, we started off in the long-term care space, and we were definitely seeing that. We were seeing medication omissions because of the packaging, or the pharmacy themselves didn't package the right medication. All types of areas where, there could be, inefficiencies or, areas of concern.
Mistakes.
Just mistakes happening, right? Manual labor and that sort of thing. It doesn't matter how passionate nurses or pharmacists or the pharmacy technicians are, great workers. At the end of the day, humans are humans. So to really provide a wrapping of technology around what was going on to prevent that sort of thing, we then branched out, where I'm really excited right now, we branched out into the home care market. So we actually came up and integrated our platform, which we've been really great at over the last number of years, into an at-home med dispense device that actually spits out medications for people at home.
Really?
We wanted to provide something that was 100% accurate, where it just, beeped and whistled. You can engage the patient with this. How are you feeling today, Randy? You can hit the happy face and send that information back to the pharmacy. I have all this information now. Right? It really is about driving the health of the patient at home and making sure you take the right medications at the right time.
So how big of a problem is it for the healthcare industry, let's say in North America, mistaken medications?
Well, if you look at a number that's thrown around all the time in healthcare right now, there's a $300 billion issue right now. 300 billion. The stats are 50% of, patients living at home on 2 or 3 plus medications, which are tens of millions of people, by the way, end up back in an acute care setting because they're just not taking their medications correctly. So it's a major problem.
Tell us your story about how you end up leading a company, a technology company, and getting out of being a pharmacist, and now actually you've got kind of the worldwide head start on this particular technology. It's amazing.
Yeah, I guess, I was fortunate enough when I came out of university, I took my first position as a pharmacist in central BC, and the individual who I worked for was actually the president of a major chain of pharmacies across the province of BC, owned and operated 5 pharmacies up north. So I really dug in and learned the business of pharmacy, which I love business. It's great. I've learned a lot about business along the way, and any entrepreneur does and is forced to learn about business. So that was very exciting for me. But at the same time, after 2 years up north, I came back to Kelowna and set up my own pharmacy. It's really about patient care, right? To grow that business, you have to be, first of all, you have to like what you're doing. You have to be very caring to people, and you can actually change the lives of people by looking at their medications, interactions, all the different things that pharmacists do. It's actually very rewarding to see what happens with the patient. I then had the opportunity to explore the technology side, which wasn't just about me one-on-one with a patient in my pharmacy. It was really about healthcare for the masses. How do I prevent these types of errors to everybody in North America? Right? It's now turning into a global opportunity. We have, groups from Australia, New Zealand, Europe coming through Kelowna to our office, looking at what we've put together, which is this ecosystem of care. So I think I'm excited because at the end of the day, this could touch tens of millions of patients and not just the patients that were coming into my pharmacy.
And you've partnered with some big companies like McKesson, really one of the biggest companies in the whole industry.
Absolutely.
So you've taken this to the next level now. So where are we going to see Catalyst Healthcare in the next year or two?
Yeah, we spent the last couple of years building out the scalable backbone to allow any pharmacy in North America to plug into what we do, have access to packaging so that they can provide it to the little devices of the world. Drop in this cartridge and you're off and running. We've got all of our FDA approvals and all the different classifications that were required just past September. We launched it here in Western Canada. Absolutely phenomenal, uptake from the individuals and the feedback. But I see what's going to happen now is we're now talking to the third-party payers, right? These insurance companies that are concerned about that $300 billion and keeping the people at home out of the hospital, because that's where the costs are incurred. How do you do that? You keep people on their medications, you engage with these patients. So pharmacies are starting to adopt across Canada. We've launched it in the US. We have a number of pharmacies with contracts in hand about to sign. So we'll have full coverage across Canada in the next 3 months. Probably every province will be live and up and running with this technology with patients out in the community. US is right behind. We're hitting the bookends, Florida and California right now. But I'm excited about the insurance players and the groups like the McKessons that you alluded to. I mean, Amazon's likely to come into pharmacy. They have Alexa sitting on a countertop that engages you, right? What's that going to do to healthcare? I think it's going to be great for healthcare, but what is everyone else going to do? We have first to market. We're going to own the countertop space, which is what it's all about. Once you're in there, right, you can help people with their health.
Amazing story, Shane, and so proud that you came out of Kelowna, British Columbia, with this, what's going to be a huge international company. And, I congratulate you because you're going to make a big difference for patients all over the world. So congratulations. Awesome. And thanks for being on Biz 101.
Thank you, Randy. Appreciate your time.
You
Take
bet.
care.